Definitely. Kelly, thanks for having me. I really appreciate it. Yeah, I'm kind of looking at this from a standpoint of, can patients now better recover now that we're working from home a lot more? And even if it's not ultimately that prolonged or consistent, I think we'll find a population that is able to work remotely far more often than we were pre-pandemic. So from a standpoint of recovering from some of these surgical procedures or other medical procedures that we talk about a lot, I think we're much better positioned now, and I think the medical device companies are better positioned now from a standpoint that their patient population, their end user, can now hang out at home for a while longer.
Yeah, it's fascinating. We all know how important that recovery is. I mean, it's kind of the difference between you springing back and really benefiting from the procedure versus not. So a lot of the names here come up. Many of them, like you said, have rallied nicely off the lows. And the interesting thing that you pointed out in the data is how quickly these procedures have seen demand snap back after COVID. You'd think people, if anything, would be putting off going back to the hospital and doing anything like this right now. Instead, that demand to you suggests this could have some life to it. So how much more room do you think these stocks have to run?
Yeah, absolutely. I think I've been very, very surprised at a couple things. The first is just the psychology of patients willing to go back into a provider, during a pandemic. I think that's happened way more quickly than I thought, and many others probably did. And then some of it comes down to provider and hospital readiness. How quickly could large hospital chains switch the infrastructure and allow for more typical day-to-day medical procedures rather than caring only for these COVID patients that were infiltrating the system so significantly in the March and April timeframe. So I think some of the demand has obviously been deferred. Those cases that were going to happen in, call it, January, February, March, the first quarter of the year, and those were pushed into the spring and summer. But I think now that we're sort of getting much more used to working from home and employers and employees are feeling more comfortable with it, I think that's going to spur another leg of growth that just has not been contemplated.